Mr. Daly is one of less than 100 nurses in the United States with training as an independent RN patient advocate. He has studied yoga for over 11 years with the well-renowned Power Yoga Master, VID00032. For those who have never tried yoga, please do. It is truly a slice of heaven for the body and the soul. And sometimes not as easy as what they make it to look like it is. Just being honest. But it is nice. Mr. Daly implemented a program using UZIT at University of Connecticut Health Center. Ed currently lives in the beautiful state of Florida, and we are very fortunate to have him here with us today in our gorgeous state of Utah. So without further ado, please put your hands together as I'm honored to present to you Mr. Ed Daly.
Please let me know. He sounds interesting. I'd like to meet him. On behalf of Donna, Karen, and the Urban Zen Foundation, it is an extreme honor to be here today and to come share our passion at Urban Zen about integrative therapies that are going on in the United States. For now, I'd like you all to find a comfortable seat, put everything down on your table, just put your hands on your lap for me. When you're ready, go ahead and just close your eyes. If you're uncomfortable closing your eyes, then you can leave them open. And I want you to begin to just become aware of your breath, the inhalation and the exhalation. And the nature of the mind is the mind wanders. And so every time the mind comes and wanders away from the inhalation and the exhalation, I want you to coax it back to just observing those simple two things. There's nothing special you need to do. You don't have to breathe in any specific way. It's just the mind continuing to watch the breath as it comes in and as it moves out. When thoughts arise, as they always do, again, it's inevitable. Come back to feeling the breath move in, observing it move in, and observing it leave the body. And then when you're ready, you can just very gently open your eyes. Several years ago, everyone, Donna Karen's husband was sick with cancer. He had lung cancer. And what was always Donna's passion was the fact that she was pulling in what she calls finally her woo-woos. And she was pulling in the folks with, the essential oils, the unlimited essential oils. She was pulling in the yoga teachers. She was pulling in the acupuncturists. She was pulling in the massage therapists. And she pulled them in to help give a more integrative approach to what was happening with her husband at that time. And at that time, a movement was born. Just as, when I was listening to Gary speak today, he's talking about, 30 years ago he started this, a movement is born. And there's a movement happening in the United States right now in the delivery of healthcare. And the Urban Zen Foundation and the Urban Zen Integrative Therapy Program is part of that movement. Now there's many facets of things happening in the hospital today, but what I'm here to present to you today is the fact that what we're doing is having an astounding effect on patient care. And so it's important to talk a little bit about what it is and how it is those things are starting to affect patients. So let's talk about the Urban Zen model, what we look at. We look at the acronym PANIC. And I remember how this all came about. I was in a car ride with Rodney, Colleen, our VID00032, who head up the yoga component of the teacher training of urban Zen integrative therapy. And Rod said to me, he said, Ed, you've been a nurse a long time. What would we see in the hospital setting? If we were to walk in here today, what sort of things would we see? And I said, well, you're going to see people in pain, they're going to be anxious, they're going to be nauseous, they're not going to be able to sleep, and they're going to be constipated as heck. And he goes, panic. And hence this model came out of play. And we go through, we look at several modalities. We look at the use of yoga. Now, when you say the word yoga, everyone, in the United States, you have to understand that there's a picture, a mental picture that people have about yoga. And if I gave you all a piece of paper and a crayon and I said, draw a yoga person, it probably would look something like this. 26-year-old female, extremely thin, ultra-flexible, and very tight clothing. And what I'm here to tell you is that that's not what we're doing. That's not what we're doing. And so in some ways, through the Urban Zen Integrative Therapy program, we have to dispel this myth of what yoga is. And I've been to a lot of yoga studios in this country, and I've taught to a lot of people in this country yoga, and I tell everybody, yoga is movement, and yoga is observation. Everybody, if you're comfortable, please just stand up for a second. And have a little bit of distance between you and the next person if you can. My job, since it's 2:30 in the afternoon and the lunch is now settling in, the eyes start to get heavier. You take your feet about hip-width distance apart and then just inhale your arms over your head. And then as you ground through the front of your heels, feel like you keep reaching up through the fingertips. And then on an exhalation, just lower your arms down to the side. And 3 times, just inhale the arms up over your head. On an exhalation, lower the arms down to the side. Inhale the arms up over your head. Exhale, lower your arms down to your side. One more time, inhale the arms up over the head, everyone. And then again, just keep feeling like you're reaching through the fingers, but the heels are descending into the earth. And then go ahead and just look up at the ceiling any amount. And then go ahead and take your arms down to the side. Interlace your fingers, everybody. Reverse your palms, and then just put your fingers